Objective Structured Practical, Clinical Examination, OSPE, OSCE, Principles and Conduction. Dr. Jalal Mohsin Uddin, DTCD, FCPS, Pulmonology. Assistant Professor, NIDCH. Learning Objectives. Comparison between OSPE, OSCE and traditional practical and clinical examinations. To explain common type of OSPE, OSCE stations. How to organize OSPE, OSCE stations. Examples of OSPE, OSCE. Definition of OSCE, OSPE. These are clinical and practical assessments where candidates rotate round and perform specific tasks in different stations in simulated environment, and their competencies are assessed using standardized scoring instruments by well-briefed and trained assessors. OSCES is mainly applicable in clinical subjects. OSPE is mainly applicable in preclinical and basic subjects. Scope for practical and clinical assessment. Mainly to assess psychomotor and affective domain. Practical skill, clinical skill, communication skill, behavior. Part of test might assess cognitive domain that are beyond to assess by oral and written test. Limitation of traditional clinical and practical examinations. Patient and practical test not equal difficult for all. Examiners not same in different years. Clinical and practical works not closely observed. Attitude and behavior not usually tested. Small number of tests do not represent the whole subject. Scope of giving feedback very poor. Advantages of OSPE and OSCE. More content coverage. Observation of the performance. Assessment of combination and behavior. Uniform difficulty for all candidates. Uniform scoring. Unbiased and fair assessment. Disadvantage of OSCE, OSPE. Difficult for teachers. Difficult for institutes. Increased cost. Common OSPE and OSCE stations for undergraduate questions. 1 procedure station. 2 question station. 3 linked station. 4 rest station. Procedure, performance, observed station. Station should be screened or roomed. The questions should be on gate and table. Observer should not ask any question. Students should wear number badge. Procedure station continue. Candidates perform procedure. Trained observer carefully observe each part of performance. Concurrently identifying the fault by cross mark in checklist. Question station, unobserved station, response station. Questions are linked with materials. The materials should be placed on table. Never give the question alone. Place the all question station to hall invigilator. Question station continue. There is no observer. Station is not roomed, screened. Candidate write roll number and all answers in separate sheet. Then sign and put in a box with narrow opening. Scoring is done after examination with the help rating scale. Linked station, linked with previous station. Example, station 12, Q. Write down the height and weight of this individual and note down it in supplied page for next linked station. Station 13. Calculate BMI of the individual and write comment on BMI. Give dietary advice to the person. Rest station. Given to accommodate few excess students. The station is used neither for taking rest nor for writing the incomplete answer of previous question. Example, we can give 2 rest station if there is 18 stations for 20 candidates. Organization of OSPE, OSCE. The activities in the organization. 1 advanced planning and preparation. 2 activities on the day before the exam. 3 activities on the day of exam. 4 activities after the exam. Advanced planning and preparation. Prepare questions, checklists, rating scales and standard answers just after each class. Cross-check by other faculties. Deposit all in the departmental question bank. Fix the examination schedules. Empower 1 teacher as organizer. Advanced planning and preparation continue. Choose OSCE, OSPE halls, wards, labs, OPD. Calculate the number of halls. Fix number of stations. Ideal 14 to 18 for final exam. 6 to 12 for formative exam. Fixed duration of stations. Ideal 4 to 5 minutes. Prepare test matrix, blueprint. Example, test matrix OSCE, Medicine, June 2021. Professional tasks and their relative weightage. History taking 15%. Investigation interpretation, proposing 15%. Performing procedure 25%. Counseling, breaking bad news 10%. Planning treatment, managing a problems 20%. Diagnosis, DD 15%. Contents area of the subject and their relative weightage in the assessment. GIT 20%. CVS 15%. Neuro 10%. RESP, DIS 15%. Infect, DIS 15%. Renal DIS 10%. Endo 10%. Example, Station 1, procedure, examine neck. Station 2, linked, question on Station 1. Station 3, procedure, take history abdominal pain. Station 4, linked, question on Station 3. Station 5, procedure, neurological exam of leg. Station 6, linked, question on Station 5. Station 7, procedure, examine chest. Station 8, linked, question on Station 7. Station 9, Q, inspect photograph plus patient and answer. Station 10, Q, written summary history plus X-ray and answer. Station 11, Q, inspect ward prescriptions. Station 12, Q, written summary history plus fluid balance chart and answer. Station 13, procedure, take history hematuria. Station 14, linked, question on Station 13. Station 15, procedure, take history acute dyspnea. Station 16, linked, question on Station 15. Station 17, procedure, examine breast. Station 18, linked, question on Station 17. 18 Station OSCE as originally described by Hardin, 1979. Example, test matrix OSPE, community medicine, June 2021. Contents area of the subject and relative. Wattage. Type of stations. Nutri FP. MCH. Environ. Stations. Width. 4. Commune. Tion 20%. Health. iCable. 20%. 20%. Dis. 20%. Performance. V. Question station. 60%. Procedure station. Procedure 20%. Health. Education. 20%. Instrument. TS 30%. Drugs 10%. Insect 10%. Parasite. 10%. 21. Advanced planning and preparation continue. Select the simulated or real patients. Train, brief the simulated, real patients, make them standardized. The standardized patients, SP, show uniform sign symptoms. Use models and modern machineries if necessary. Advanced planning and preparation continue. Select the observers, MO, lecturers, assistant registrars of same or other departments. Train, brief the observers for uniform scoring. Decide for scoring for the stations. Inform the students about rules. Arrange budget and refreshment. Activities on the day before the exam. Check the examination hall and stations. The equipment and questions. Instructions for students, patients, examiners. Light, electricity and ventilation, fan. Refreshment, drinking water, tissue paper. Toilet and water supply. Activities after the day of examination. Collect answer sheets and rating scales. Compute the result. Give feedback to students. Informative assessment. Gather written comment for improvement. Preserve the questions and documents. Example, first professional MBBS examination, July 2014 OSPE station number -3, procedural. Sub. Physiology. XYZ Medical College. Time 5 minute. Session. Marks 5. Question. Measure the blood pressure of this individual. Additional instruction. Memorize your findings for the next linked station. 28. 29. For 20 to 25 candidates we may require 3 simulated patients and 2 observers. It is better to use a simulated modern machineries, without any harm to the patients. Checklist. for examiner of the procedure station. First professional MBBS examination, July 2014. OSPE station number -3, procedural. XYZ Medical College. Area of the performance. 1. Greeting with the patient. 2. Introducing the candidate himself, herself. 3. Explaining the purpose of the examination to the patient. 4. Seeking permission for the examination to the patient. These are least important jobs. Sub. Physiology. Session. Candidate's role. Number. 690,691,693,694. 0.10.10.10.1. 010.10.10.1. 0. 1 and 0 over 1 0.10.1. 0.20.20.20.2. Role No. Checklist for examiner content. 690,691,693,694. 5. Exposing the right hand, forearm, and at least lower 2/3 of upper arm. 6. Placing the cuff and upper arm 2 inch above the elbow crease. 7. Palpating the brachial artery. 8. Placing stethoscope's diaphragm over the artery below the cuff's edge. These important jobs, performance areas. 0.50.50.50.5. 0.50.50.50.5. 0.50.50.50.5. 0.30.30.30.3. 9. Placing the earpieces in the ears. 0.20.20.20.2. Role No. Checklist for examiner content. 690,691,693,654. 10. Inflating cuff rapidly until the sound. 0.50.50.50.5. In the brachial artery disappear. 11. Continuing inflation 30 to 40 mm of mercury. More. 030.30.30.3. 12. Deflating by release air from the cuff 0.50.50.50.5. 13. Not more than second inflation in. Deflation is done near systole and diastole. 14. Deflating at a moderate rate. 2 to 3 mm sec. These are important jobs, performance areas. 0.50.50.50.5. 0.20.20.20.2. Role No. Checklist for examiner content. 690,691,693,654. 15. Thanks given to the patient. 0.20.20.20.2. 16. Expressing air from the bladder. 0.20.20.20.2. 17. Resets the instrument. 0.10.10.10.1. Total marks obtained equals name of the observer, signature of the observer, question station, linked questions of the previous station. First professional MBBS examination, July 2014. OSPE station number -4. Sub. Physiology. XYZ Medical College. Session. Time 5 minute. Total marks 5. Question. Marks. 1. Name of the instrument you have used at the 0.25 previous station. 2. Name of sound that you heard in the 0.25 stethoscope. 3. What was the posture of your subject during 0.25 measuring BP? OSPE station number -4. Counted. Marks. Question. 4. Name of the artery occluded during the measuring BP. 0.25. 5. What was the systolic pressure of the subject? 1. 6. What was the diastolic pressure of the subject? 1. 7. Calculate pulse pressure of this subject. 1. 8. Write your conclusion about the result. 1. These are most important part of the questions, here 80% marks allocated. Blank answer script of the linked question station. First Professional MBBS Examination, July 2014. OSPE Station Number -4, Linked Station. Sub. Physiology. XYZ Medical College. Session 2010-11. Roll number of the candidate. Answer of the questions. 1. Name of the instrument. 2. Name of the sound. 3. Posture of the subject. 4. Name of the artery. 5. Systolic BP equals. 6. Diastolic BP. 7. Pulse BP. 8. Conclusion equals. Blank answer script content. Signature of the examinee. Total marks obtained equals. Signature of the examiner. Rating scale with standard answers. First Professional MBBS Examination, July 2014. OSPE Station Number -4, Linked Station. Sub. Physiology. XYZ Medical College. Session 2010-11. Correct answer. Marks. 1. Screw gauge type sphygmomanometer. 0.25. 2. Karatkov sounds. 3. Sitting position. 0.5. 0.25. Rating scale with standard answers content. 4. Brachial artery. 0.5. 5. Systolic BP equals 110 plus or minus 5. 1.0. 6. Diastolic BP equals 75 plus or minus 5. 1.0. 7. Pulse BP equals 35 plus or minus 10. 1.0. 9. Normal blood pressure. 0.5. Total. 5.0. Station 9. Example. A question station. Third Professor. MBBS exam. OSPE Station No. Medical College. Questions. Minute. July 2014. Sub. Pathology. Session. Time 3. Marks 5. Marks. 2. 2. 1. Identify the structure focused under microscope. 2. Name 2 structures within it which helped you to identify it. 3. Write down the histopathological types of the lesion. 1. Conted. Example. Rating scale of the question station. First Professor. MBBS exam. OSPE Station No. Medical College. Time 3 minute. Standard answers. 1. Hodgkin's lymphoma. 2. A. Lymph node. B. RS giant cell. 3. A. Lymphocyte predominant. B. Lymphocyte depleted. C. Mixed cellularity. D. Nodular sclerosis. July 2014 Sub. Pathology. Session. Marks 5. Marks. 2. 1. 1. 0.25 x 4. References. Hardin, and Gleason 1979. Assessment of clinical competence using an objective structured clinical examination, OSCE. MedEduc Jan. 13, 1, 41-54. Hardin, Stevenson M., Downey W.W. and Wilson G.M. 1997. Assessment of clinical competence using objective structured examination. Bridge Med J. February 22, 1, 5955, 447-51. Khan K.Z., Gaunt K., Ramachandran S. and Pushkar P. 2013. The Objective Structured Clinical Examination, OSCE, AMI Guide No. 81. Part 2, Organization and Administration. AMI Guide, Medical Teacher 35, E1447 E1463. Khan K.Z., Ramachandran S. and Gaunt K. 2013. The Objective Structured Clinical Examination, OSCE, AMI Guide No. 81. Part 1, An Historical and Theoretical Perspective. Web paper AMI Guide, Medical Teacher 35, E1437 E1446. Questions? Thank you all. OSPE, OSCE Principles and Conduction. Learning Pulmonology.
you.